The patient concierge might not have necessarily taken the initial phone call to do the patient filtering or has had any patient interaction at this point. So there's an opportunity to introduce them through a courtesy phone call with the patient. A courtesy phone call confirms the patient's reserved appointment time and introduces the concierge to the patient, perhaps for the first time. The transition to our office needs to be as smooth as possible, so our concierge conducts this type of phone call using their best court sense. This second phone conversation with the patient helps clarify any missing or muddled chart information and establishes a personal relationship between the new patient and our team. Some offices rely on an automated phone call or an appointment reminder. Our team does rely on automated phone calls for other kinds of appointments, but for the new patient phone call, a live call from the concierge is what sets us apart. We believe this distinctive touch and establishing a point of contact within the practice is crucial to creating the atmosphere we want to develop. After the courtesy call, the last part of the preparation happens at our team morning meeting on the appointment day. In this meeting, we designate who, if not the concierge, will get the new patient phone call intake form to use in the operatory for additional appointment notes. Also, we discuss who may be available to help support the appointment so it goes as efficiently as possible. We review each new patient as part of the morning routine, which it typically takes about 1 to 2 minutes for each one to make sure our team is aligned and ready. This is where the initial phone call filtering helps again. If the new patient is a presumed healthy mouth and is scheduled for hygiene, our hygienist gets the form and the concierge seats the patient in the hygiene room and helps support the hygienist through the appointment. If it's an emergency patient, the concierge seats and hands off the new patient to an assistant so that treatment can be discussed. If it is a complex case, the concierge will greet, seat, and start with the collection of the clinical information. The concierge may have already had at least one phone conversation with the patient, which helps with the patient anxiety in the operatory. With the team member ready and prepared, we are now set to deliver an exceptional experience by welcoming a new patient to our dental family.